All right, thank you very much, Beamer. Well, of course, we are talking about breast cancer all throughout this month. 1 in 8 women will develop breast cancer in their lifetime, but early detection could make all the difference. October is also Breast Cancer Awareness Month, of course. Joining us right now to talk about so many things that are important to your health, Aaron Young, certified breast cancer nurse navigator, and Dr. Morton Collenberg. He is the medical director for Baptist Cancer Center and a surgical oncologist. Thanks for coming on the show today. All right, we got to get the conversation going about breast awareness, health awareness, mammograms, self-breast exams, that kind of thing. So how important, first of all, if you feel a lump, what are you supposed to do? Because the first thing you want to do is panic. What should you do?
What you should do is reach out to your trusted primary care physician, your go-to person. Sometimes it's a obstetrician, gynecologist. Certainly you want to do self-breast exams, so that's very much encouraged. But when you find it, you need to reach out to somebody who's experienced in doing breast exams.
Yeah.
And then depending upon age and how that mass feels, one can then follow up with additional imaging, such as ultrasound or mammogram.
Right. Okay. And what are the best ways to find lumps? Is what? Mammogram? Self-breast exam? Both? Ultrasound? MRIs?
I think the American Cancer Society guidelines encourage women to kind of get to know the look and feel of their breasts from really early on. We all have lumps and bumps in our breasts, but it's just really kind of noticing changes in that month to month.
Yeah.
So that really helps women keep up on top of what might be abnormal in their breasts that they're feeling.
And so there's some, conflicting reports on how often you should get mammograms, if you should even get mammograms, who are the best candidates for it, do you even need it? What do you want to say to clarify all of those potential myths?
Sure, and you're right. There's been controversy that dates back now about 2 years, but for our audience, 40 years and older, for the general population, it's an annual screening mammography. If there's something that's abnormal that's found, sometimes the frequency is increased. But for everybody over the age of 40, if there's a strong family history, you may actually start earlier than that. And again, that's where experts, for example, within our network can really help with that.
Something that really isn't talked too much about are breast implants and how sometimes during a mammogram, the x-ray cannot penetrate, cannot see through the implant, and so it blocks some tissue. What do you recommend to patients who have breast implants when it comes to screenings?
So the screening is the usual schedule. Most implants today are put underneath the pectoralis major muscle. So it actually pushes the breast tissue forward. So it compresses breast tissue. That's the challenge for skilled radiologists. So it's not as if it's obscuring, but sometimes with the compression it makes things a little bit more difficult to look at. Additional views can be obtained, special studies can be obtained, but it should not be a reason not to pursue screening mammography.
I tell you what, we could sit here and talk about this all day long. There are so many questions and so many people have such a need for information. If they want to get additional information, all you have to do is call the number here on your screen, 866-445-3668. You can head to this website right here, baptistbreastcenter.com. So much information is out there for women that could literally save their lives. Thank you so much for coming on the newscast today.
Thank you.
All right. Beamer